Oh my god, I'm so nervous. I can't believe this is happening. My first real patient. Oh, okay, he's a 24-year-old male in for a wellness visit. Oh, I hope he's not cute. Oh my gosh, I'll get so distracted. Oh, focus, Samantha. Okay, what's the first thing to do? Well, since high blood pressure is the most commonly diagnosed condition in outpatient settings, affecting about 30% of the population, I better check for that first. It's really important to screen for it in all adults ages 18 and older because it's a huge risk factor for heart attack, stroke, and chronic kidney disease. It only takes a minute and there's really nothing to lose by checking it. In fact, there's good evidence that screening for high blood pressure really reduces the incidence of cardiovascular events. Okay, great. So I'll do the blood pressure first and then everything else? Okay, how did I get hired? I don't know. Hello, Mr. Cody? Oh my god, he's cute. I'm Sam. I'm going to be your PA today. What brings you in?
Just in for my yearly physical.
Okay, great. Do you have any symptoms you'd like to address today?
No.
Okay, great. Has anyone taken your blood pressure yet? If it took my blood pressure, it'd be through the roof.
No, not yet.
Okay, great. Can you please stop saying okay, great? Guess we'll do that now then. Oh my gosh, say something. This is so awkward. Say anything. Say anything. So if we're taking an office blood pressure like we are right now, it's best to take multiple measurements over time because that has a better positive predictive value for high blood pressure than just a single measurement. Your blood pressure is also affected by various short-term factors like emotions, stress, pain, physical activity, and drugs. And some people actually have white coat hypertension, which is kind of just like high blood pressure in the clinical setting only. And it's actually known that 15 to 30% of people that have hypertension, they might have lower blood pressure outside of the office setting. Some of the disadvantages to diagnosing high blood pressure only in the office setting include measurement errors, limited number of measurements, and the white coat hypertension that we were just talking about. So, in addition to office blood pressure monitoring, there's two other options. There's ambulatory and home blood pressure monitoring. So, I know, it's so interesting, isn't it? So they're both used to confirm a diagnosis of hypertension after the initial screening in the office. So ambulatory blood pressure monitoring, those are just like small little portable machines, and they record blood pressure at regular intervals over like 12 to 24 hours while the patients do like normal activities and even while they're sleeping. And these measurements are taken 20 to 30 minute intervals. And the home blood pressure devices, they're fully automated and you can actually buy them in like stores around the community. Some other bits of info that I thought you would really like to know since you're getting your blood pressure taken is that if a patient has a high ambulatory or home blood pressure, they are at increased risk for cardiovascular events, stroke, and all-cause mortality, independent of their office blood pressure reading. So even though the home blood pressure is really good, studies have shown that the ambulatory blood pressure monitoring should be used as like the reference standard just because it monitors more often and it's just better at confirming the diagnosis of hypertension. So, yeah. Okay, so I know you're wondering, how often do people have to come in to get their blood pressure checked? Well, I'll tell you. So, if you are 40 years or older, you have to come in annually. And you also have to come in annually if you are at increased risk for high blood pressure. So that would be somebody that has like a high normal blood pressure, somebody who's overweight or obese, and then also African Americans. So now you, since you're 24 years old, you would be in the age range of 18 to 39. So people in that age range, if you have normal blood pressure, you have to come in every 3 to 5 years and get your blood pressure screening done. So when you're treating high blood pressure, you want a goal of 140 systolic and 90 diastolic. So if lifestyle changes don't work and you have to use medications and your patient is a non-Black patient, you would start your medications with one of the following: a thiazide diuretic, calcium channel blocker, an ACE, or an ARB. But if your patient is Black, the initial treatment is either a thiazide or a calcium channel blocker. But if your patient also has chronic kidney disease, you have to either start with or add on an ACE or an ARB, but not both. Yeah, you really shouldn't have said anything.
Wow. You know so much.
Oh, well, thanks. Oh my god. Okay, since you're 24 years old, we'll see you back here again in another 3 to 5 years for another blood pressure check. Okay?
Okay.
It's a date.